What causes back pain? While considering back pain, we should worry about its variations. For example, back pain can begin with slip discs, which in clinical terms is called herniated nucleus pulposus (HNP). HNP is a condition where part or the entirety of the delicate, coagulated focal segment of an intervertebral plate is constrained through a debilitated piece of the disc, resulting in back discomfort and nerve root disturbance. Specialists characterize slip discs as ruptures of the intervertebral plate. The intervertebral rests between the vertebrae, spinal column, of the spine. The interference has variations, including the lumbosacral, L4 and L5, just as cervical C5, C7. The cervical is at the neck and has a place with different pieces of the back and neck. At the point when specialists consider slip discs, they frequently glance through etiology, which incorporates neck and back strains, injury, trauma, intrinsic, natural bone contortion, constant heavy lifting, deteriorated discs and/or weakness of ligaments. After cautiously considering, etiology specialists think about pathophysiology, which incorporates distensions of the core pulposus. The middle associates with the section or spinal canal and may be packing the spinal cord or the nerve core, or roots, which causes back pain. In the event that the spinal cord is compacted, controlling the roots and core, it can cause back pain, numbness, and the motor functions may fail. The assessments in clinical terms depend on lumbosacral, which may incorporate intense or constant aches and pain at the lower back. Lumbosacral is of or identifying with or close to the small of the back and the back piece of the pelvis between the hips. The lumbosacral intersection comprises of the L5 vertebral body articulating with the principal sacral vertebral body. In a seated position, the lumbosacral discs are stacked triple times more than standing. The L5S1 disc is deep within the pelvis and doesn't have a lot of movement. It is likewise associated with the sacrum by a large ligament, sacral alar ligament, which helps limit movement. In this manner, the pain could spread out to the glutes and advance toward the legs. The individual may feel weakness and/or numbness. Furthermore, such pain and discomfort can cause tingling around the legs and foot. The last evaluation may incorporate ambulation, which rises out of agony. The cervical is thought of. The symptoms the specialists search for is neck inflexibility, deadness, weakness, and tingling of the hands. On the off chance that the neck pain spreads pain down to the arms and proceed to the hands, specialists will consider slip discs. However, different side effects may happen, for example, weakness that influences the farthest point or the higher limits of the body. The lumbar curve is at the lower back region and is arranged in the midsections or the smallest area of the back, which specialists consider additionally, particularly if the patient has difficulties straightening this region with the curved shape of the spine, scoliosis, and away from the area impacted. At the point when specialists consider back pain, they will review the diagnostics subsequent to directing a progression of tests. Diagnostics may emerge from ligament reflex, X-rays, EMG, myelograms, CSF, and additionally Lasseguet signs. Lasseguet sign, otherwise called straight leg raise test, SLR, is positive when there is a sensation of pain by applying strain to the piriformis muscle and its tendon, especially when the hip is flexed at a point of 90 degrees and the knee is extended. The agony or delicacy is frequently limited nearby the more prominent sciatic indent. CSF causes the specialist to examine the expansions in protein while EMG helps specialists review the association of the spinal nerves. X-rays are utilized to help specialists see the tight disc space. Tendon reflexes are tested, which the specialists use tests to look profoundly into the depressed region, or the missing upper limit reflexes, or in clinical dialect the Achilles responses or reflex. Myelograms helps the specialist in checking whether or not the spinal cord is compacted. The tests start if the Lasseguet signs show positive outcomes behind etiology discoveries, pathophysiology, assessments, etc. How does specialists oversee slip discs? Specialists endorse the executives in clinical plans to disengage or relieve back pain. The administration plans may incorporate eating regimen while the calories are set by the patient's metabolic requests. The specialist may expand fiber consumption, just as power liquids. Extra treatment or management may incorporate hot pads, dampness, etc., and as well as heat compressions. Specialists frequently suggest prescriptions for the pain too, like those with NAID. Prescriptions for the pain includes Motrin, naproxen, Dolabid, or diflunisal, Indocin, ibuprofen, etc. Extra drugs may include muscle relaxers, like Flexeril and Valiums. The basic relaxers are diazepam and cyclobenzaprine hydrochloride, which diazepam is a Valium and the others, Flexeril. Muscular systems are likewise recommended to decrease back pain, which incorporate cervical collars and back supports such as back braces. Are you ready to take back control? Resolve your back pain? Accomplish your goal of getting back to pain-free workouts and/or living by fixing your back without appointments, medications or surgery. Click on the link in the description below, and win your war against back pain starting today.